Thanks very much, Chair. Thank you very much for the invitation. Great pleasure to be here. Two slides, we were told. This doesn't count. That's my first one. The Chair asked us to identify three things that we think are important in some way, in the way health technology assessment is being introduced and increasingly influences policymaking from the perspective of countries like England that have a relatively well-established health technology assessment system in place. So these are my three. First of all, there's a lot going on around pricing and reimbursement for technologies, and specifically pharmaceuticals. And the question is how HTA can or may not be linked to this process. So is there a possibility to have evidence-based pricing? We're talking a lot in the UK now about value-based pricing, and there is a consultation ongoing about how this would work beyond 2014. We're already doing a lot of risk-sharing and patient access schemes at NICE, working closely with the pharmaceutical industry, and of course there's this whole idea of coverage with evidence development, or the sort of conditional reimbursement decisions, conditional upon the generation of more evidence and re-evaluation. So I think pricing and HTA is one important issue. HTA and disinvestment is another one that I think is extremely important, certainly for us in the UK, where the National Health Service can spare no more extra funding. So growth is practically zero now in the healthcare budget. So how can we carry on doing what we're doing, what we have been doing, whilst being confident or not, now crowding out other more cost-effective, more valuable technologies and services in the National Health Service. And there's a lot of issues there around the methodology and the process and the acceptability of making disinvestment recommendations based on HTA. And the third point, HTA and social values, the ethics of health technology assessment. I think there's a lot of work that we are doing and that we should be doing more of to engage with people to try and understand what the value judgments are that we're using in making these decisions, and what our stakeholders' value judgments are, and how we can elicit those and articulate them, and how we can meaningfully incorporate them into the decision-making process, and then ideally at some point try and evaluate what the impact of this whole process has been. I think this is an evidence, almost an empirical evidence lacking field, and I think it's very much worthwhile working in this area for helping communicate better what we do and making sure it's more relevant locally. So this is my second slide. I just thought I would come up with a fourth point, and the Chairman already mentioned it: health technology assessment and innovation, and the importance of not viewing and not perceiving health technology assessment as a stifling activity, and certainly not allowing health technology assessment to stifle the opposite. In fact, health technology assessment, I think, can be a driver for innovation, for adoption of new and good value technologies that work. So I thought that my last slide would be two quotes. This first one is from a gentleman working at the Leonard Davis Institute. So he's saying industry shouldn't be afraid of comparative effectiveness. They would be better off embracing it and trying to use it rationally rather than fighting it. The solution isn't marketing. They should be focusing on innovation. And this is a quote from Mark Polly, a very well-known health economist, who I guess it's a bit more pessimistic view. They, being industry, may save themselves if they come up with a wonderful product at a wonderful price, but they may need to light a votive candle. Thanks very much.
Great, many thanks, Kalipso, and brilliant. 4 minutes, not even 5, so this is going well. Laura, please. Laura, we've just heard a perspective, as Kalipso said, from the mainly developed countries, or countries with developed HTA systems. Laura is going to give us a perspective from the hospital and the healthcare decision maker.